Buprenorphine is an FDA-approved medication that helps people with opioid use disorders by reducing cravings and the symptoms of withdrawal. Buprenorphine therapy is an evidence-based practice that increases a person's ability to participate fully in a comprehensive substance use disorder treatment program that may include hospitalization, counseling, case management, medication, and recovery support services. Eric Harum helped to establish and expand a successful buprenorphine treatment program, Buprenorphine for Opioid Use Disorders, at the Addiction Resource Center in Brunswick, Maine. Harum is also an experienced process improvement coach and has coached multiple NIATEX projects. In this video, part of the series on reducing barriers to buprenorphine treatment, Harum shares successful strategies for reducing and preventing diversion of the medication.
I think prescriber fears about diversion, first and foremost, there's some validity there. There is a significant and undertreated opiate addiction problem across the entire country, making medication like buprenorphine highly valuable to individuals who want to stop chasing prescription illicit or other forms of opioids for an illicit habit or addiction. That dynamic itself is one of the things that drives diversion, right? Is that this medication works, people can't obtain it, and they know that if they could, it would work. So I think validating that concern is important. On the back end of that is we really have gained a great deal of experience over the last 16, 17 years with medication-assisted treatment with buprenorphine products, understanding ways to mitigate diversion potential. And those, for lack of a better way to put it, the recipe of things to do, checks and balances, internally as well as with your patient population, can be extremely effective, are an important part of adherence in treatment, reinforcing norms of that exist within the goals of recovery and the kinds of skills and the kinds of skill acquisition that we're wanting to teach our patients as they evolve through the treatment process. An individual's risk factors that would demonstrate a person's inability to self-administer a scheduled narcotic, right? And that's sort of the gold standard. And so things like unstabilized, severe and persistent mental illness, significant and long-term homelessness, residing with known dealers of illicit substances, significant history of convictions for distribution. Right? These are all significant risk factors to bear in mind. And whereas you may think that anyone who has an opioid addiction would have those exclusionary characteristics, that indeed is not the fact. There are a great many patients with opioid addiction who do not have those significant risk factors that make them excellent candidates for outpatient medication-assisted therapy. For clients with those significant risk factors, looking at the treatment level of care, so upping the intensity and the level of restrictiveness of the environment, combining a community reinforcement model through programs like problem-solving courts and drug courts, even residential placement. These are all environmental factors that can provide appropriate protections for anyone looking to start an MAT program at whatever scale, small or multi-site. There are some very clear items in a recipe that we would recommend to dial into your diversion mitigation plan. So making plans for regular random urine drug screening. And there are a range of products available for different providers and institutions. There are on-site tests that give you rapid results. There's things that you can send out with proper chain of custody that have a GCMS level of quantitative analysis. Certainly would recommend that whatever urine drug screening or laboratory work that's being done, that it's being done with what's being called a CLIA-waived process or lab product, and that's important for quality. Also looking at regular and random pill counts or film strip counts, depending upon the formulation of buprenorphine that your patients are using. We've developed several tools over the years that can make film strip or pill counts very quick and efficient. You know, a nice little one-pager with a grid that'll show the number of tabs down one side and the number of days in the month on that side, and you can just bring them together and very quickly find out what the appropriate number should be. I have to say that our preference, based on the data that we collected, is to blister pack generic buprenorphine versus using brand name Suboxone in the gel strip formulation. Blister packs are, about the size of a person's cell phone. Most of us have gotten an over-the-counter medication, maybe cold medicine or something, and it comes in a nice little blister pack, and you can just pop one out at a time. Those are very, very fast to count. Once the seal or the foil is broken, that tablet doesn't count, whether it's in there or not. And so unlike the gel strips, which can be easily loaned to peers and colleagues who are called in for film strip counts and don't often contain linear lot numbers on the wrapper, we found that adherence rates with blister packing were double than they were when we were trying to count with gel strips. That was a significant discovery for us, and certainly one part of the recipe that I want to make sure to pass along. We had very good results conveying that information to local pharmacies and them agreeing to incur the extra $1 per prescription it cost for them to blister pack. The behavior of patients, looking at progress on treatment plan goals, looking at show rates in psychotherapy or groups, self-help attendance, pro-social behavior. Right? What we're looking for in our interactions with our patients is congruency. Right? And so are the things that you're saying that you're doing matching the behaviors we're observing during the time we're together? When you put that kind of behavioral congruence together with frequency of contacts and these diversion mitigating strategies of pill counts and urines, you get a pretty strong recipe for feeling confident about how your patients are doing.
Stay tuned for the next videos in this series, which will address other barriers that limit use of buprenorphine for treatment opioid use disorders: stigma, finding a way to pay for the medication, and lack of physician prescribers.